Tristan, I'm Jaron. Good to meet you.
Nice to meet you, Doc.
Come over, have a seat.
Yes, sir.
Well, welcome to the office.
Glad to be here.
Now, I was watching you walk. It seemed like you had a little bit of a limp there.
Yeah, I've got a itch to get along today.
Okay. Is that the main reason you're here today?
Yeah, low back pain.
Low back pain.
Yeah.
Okay. And can you tell me a little bit more about that low back pain when it started?
I've dealt with low back pain off and on for probably 5 or 6 years now, but more recently, about 3 or 4 months ago, I was going through a squat workout, and as I was going down on one of my reps, I felt a big snap in my low back, and then also just a sharp radiating pain and then the tingling sensations down my right leg.
Okay.
All the way down like calf area.
Down to the calf?
Yeah. And ever since that squatting injury, for a couple weeks, I wasn't able to move. I was on my couch, really just kind of non-ambulatory for a while. I guess patients won't know what that means.
Okay. It's all right. Are you having any of that pain, tingling, numbness down the leg today?
I get it, yeah, if I move the right way, it'll shoot up to like a 3, 4, just noticeable. But when it first happened, it was probably like a 7 or 8.
And what movement is it that sets it off?
Like leaning forward and then leaning to my right hand side really causes some issues.
Now, what other therapies have you done for the low back?
I've seen some other chiropractors, and got temporary relief, but nothing like long lasting that I was looking for. And then I've tried acupuncture, that didn't help. Dry needling, that didn't help. The athletic trainers didn't help. I had epidural steroid injections. Those helped for maybe a day, but that could have been a placebo. I don't know.
Okay. Now, with that low back pain, have you had any loss of bowel or bladder function?
No.
Any issues with standing on your tiptoes or on your heels?
No. If I go for longer walks, sometimes it's like starts to feel heavier, but it's not necessarily like a weakness sensation yet. All I guess heavy.
Okay. Are there any other complaints you have today?
I mean, just that low back pain. I do get some occasional like mid back pain or stiffness.
Is that painful today?
Yeah, it's pretty stiff today. Mainly because I've just been leaning to the left, trying to get away from that sensation for so long.
And what would you rate that pain today?
In the mid back,
Uh,
it's not too bad today.
on a scale of 1 to 10, 10 being the worst in the hospital with an IV drip?
Maybe like a 2.
2. And then what's the worst it's ever felt?
The mid back.
Yeah.
Maybe 5.
5 being the worst. Okay, you ever get any neck pain? Since you're leaning over in those weird directions?
Yeah, I've been getting some cramps and stuff on this left hand side just because I'm leaning so far to the left.
Okay, any shooting down into the arms or?
No.
No. You said it's more like a cramping feeling?
Yeah, it's just right there on the left hand side.
Okay. And is that painful at all today?
Like a 1 or 2 again. Just noticeable. Everything's.
And what's the worst it's ever felt for you?
If I sleep wrong, you can get up to 6.
Okay. Now, with the neck pain, do you get any headaches associated with that?
When I was in school, or I guess at this time of the story, I was still in school. So yeah, I'm in school. I would get occasional headaches from looking at like computers for too long or something like that, but nothing that was really too much associated with the neck pain or stiffness.
When's the last time you had a headache?
About a month ago.
And can you tell me a little bit more about the headache? What part of your head it was on?
It was kind of on like the left hand side here. I
Okay.
started in the back and came forward.
Okay. With the headache, did you get any tingling or numbness to the face? No. Any drooping of the face muscles or drooling?
Not that I was aware of.
Dizziness or nausea?
Mhm.
No, nothing like that.
Yeah.
Okay, and when you got that headache, that's not giving you any trouble today, you're saying? Okay.
I haven't had one for about a month or so.
Since about the month. And when you did have it, what pain level was that?
Maybe like 3 or 4. It was subtle, but definitely noticeable. I also had been working outside all day and hadn't been drinking enough water, so that was probably not helping.
Okay. Now, have you been in any car accidents?
So let's stop right there for just a second. Those were all great follow-ups to the question, but remember acuteness. Last 3 months, you want to say when was the onset of your headaches? How long have you been having headaches? That's a really important question.
Well, he did mention it was a month ago.
No, it's when he had his last headache.
When you had the last one?
He didn't say that's when they started.
Oh, gotcha, you're right. So you said the last headache you had was about a month ago. Now, with those headaches, were there more before that? When did they start coming on?
I'll get one about every 2 weeks to every 4 weeks, maybe
Okay.
1 to 2 a month.
And
He
that's
still
been-
hasn't
that's
answered
been-
your question though.
That's been going on for how long?
How long have you had headaches? Is a real simple question.
Probably 5 or 6 years now.
Yeah, see,
Since I
that
started
clears
school.
right there.
Yeah, yeah.
That's your main clearance right there. But you have to know duration. How long have they been going on? How long have you had the headaches?
Gotcha.
And then the secondary is some tingling in his face or head, dizziness and nausea, not the drooping or the saliva. That's more stroke related to see if they've had that.
Okay.
You're trying to pick off a potential stroke.
Gotcha.
And what are you gonna do for that if he said it was acute?
Send them to the hospital.
Right.
I call an ambulance.
To rule out,
Don't let them drive themselves, because then that comes back to you.
to rule out
Drive themselves or somebody else.
spontaneous cervical artery dissection.
Okay.
And just put that in your notes too, that you did that.
I don't want to tell them.
Just like that guy on Monday, I wrote it in his assessment that I sent him to the hospital to rule out spontaneous vertebral artery dissection.
Okay.
And no treatment was provided. No exam or treatment really. Because you don't really even want to put those patients through a maximum foramina compression test either.
Sure. Sense
Then they'll turn around and try to blame you.
Yeah.
Okay, Tristan, have you had any surgeries?
I had 2 knee surgeries. I had a
What was-
fractured femur when I was 15 from a football injury, and at the same time of that injury, I had a torn ACL. So they went in on the first surgery and put 2 screws in my epicondyle, and then on the second surgery, like 8 weeks later, they took the 2 screws out and repaired the ACL.
And that was in what year?
Oh Lord, 2014, 2012.
Okay. Any other surgeries or hospitalizations?
I had the 2 epidural steroid injections in my lower back.
And those were how long ago again?
About 2015. Only.
Yes.
I'm giving you the
I
time
was gonna
frame
say,
of.
I guess it helps to know what year we're in right now.
Yeah, I'm giving you the time frame of, because this history that I'm giving you was me in 2015. So
Okay.
at the time it had been, oh yeah, ESI 6 weeks ago.
It was pretty recent then.
Yeah, after I came and saw him probably about maybe less than a month after, about 4 to 6 weeks after I had the last ESI.
Okay. And Tristan, are you on any medications right now?
No, at the time I was on Vitamin.
Okay. Now, have you ever been diagnosed with anything such as stroke, heart attack, TIAs, blood clots, diabetes, atherosclerosis,
My blood pressure
cancer?
at that time ran a little bit high, but I was also 300 pounds. So
Okay.
that helped me out.
That's good. You got to list out the whole
Yeah.
list of them.
Did
You
I get
can't
them all?
just, yeah, you did actually. It was good.
Even when you do those, sometimes they won't want to tell you, because like I said,
Yeah.
that one.
Well, I had that heart attack, yeah.
Yeah, that one
Yeah.
patient that I had, I said cancer, stroke, heart attack, gave him the whole list,
Yeah.
and sitting there shaking his head the whole time. No,
But
no,
you
no,
can
no.
write down confidently ROS normal.
Yeah.
None other than NMS.
Yeah,
symptoms.
exactly.
Okay. But then during that, I was doing his deltoid test. I'm getting 56 years old. I had a heart attack a few years ago.
Yeah.
Okay, well, I asked you about that, and you're just not telling me. So, oh, I didn't know you wanted to know about that. Yeah.
Yeah.
That's why I asked.
Well, they don't get it, so you got to drag it out
Just
of
my
them sometimes.
spine. What does my heart matter? You know?
Right.
You always got to be paying attention.
Tristan, do you have any other complaints today?
I'm trying to think of what else. I'll get occasional knee stiffness from the injuries I had suffered back in the day.
The right side?
Yeah, right knee.
And
That's the same side of the injuries.
is that bothering you today?
It's a 1.
Okay.
The altered gait patterns.
And now you've had some surgery on it before, so what's the worst it's ever felt?
It was a 10 when I broke it. Yeah.
Probably 10 because you were in the hospital getting surgery on it?
Yeah, I was screaming and
Okay.
I almost passed out on the sideline because they started doing anterior drawer tests and they're like, yeah, we think you have a torn ACL, but they were just moving my femur around.
Yeah.
So, yeah. My sister
Ouch.
said my face went flush white and I was like starting to fall backwards and she caught me on the
Oh, I would've-
bleachers.
I would've
down
passed
the
out.
bench. Yeah, I was starting to.
That wasn't very smart on their part.
Well, yeah, they didn't know that a fractured femur had occurred. So.
Yeah, but still, I mean,
Yeah. Just the week before, one of my best friends, who was also a defensive lineman, tore his ACL. So they're like, "Oh no, is it another torn ACL? Let's check."
Oof. Any other complaints today?
No. traffic.
There you go.
There's a fire again off of 249. Just got
I've
smoke
seen more
over.
car fires lately than anything.
Did I ever tell you about the one that blew up right over here?
No.
As I was seeing the patient?
Mm-mm.
It had like a bomb going off. Me and the patient both looked up like, what in the world? And then all of a sudden right here on the Beltway, there's a car up in flames and people standing there going, oh my gosh.
Back in 2013, there was a car that crashed into the toll booth and burned up right down the street here. And we were looking at it.
I miss any questions?
Yeah, it always ask this too. Have you been adjusted by a chiropractor before? And when was the last time you got an adjustment? And what was it for? And did it help you?
Okay.
Because what's that also? What are you doing with that question? What's the purpose of that question?
Figuring out if the adjustments had helped or worsened it and documenting that and seeing if, that made the issue worse or better.
Well, and also a lot of times they'll say, well, yeah, I went there, but it actually got worse when he stuck me on my side and did that side posture lumbar roll adjustment. So what do you do with that? You document that because your adjustments aren't causing his back issues. The other guy, the way he was doing it was.
Gotcha. Now,
It can
Tristan,
also,
It's another CYA.
and it can also throw up some flags if someone's like, yeah, I've been to like 7 or 8 chiropractors,
Right.
they all hurt me.
Right.
And that kind of throws up some flags to say, hey, maybe this is a patient that,
You don't want to accept.
yeah,
sure.
Because you don't want problem
They're
people
looking
that are
for-
always placing blame on somebody,
Yeah.
you know.
Now, Tristan, you said you were adjusted for this low back problem. When was your last adjustment?
oh man, that time, probably about 2 months ago.
And did it help you?
Not really.
Did it seem to give you any relief or make it worse or?
Maybe like a 1 point reduction in relief because I had got up and gotten moving. They tried to take me through a bunch of exercises too to help with my herniated disc.
And what type of treatment did they do for you?
He did side posture adjustments, anterior thoracic adjustments. He showed me like some core stability exercises. Typically.
Stem, hot pack, roller
Luckily,
table.
he didn't do any of that stuff. I don't
Yeah.
know. I mean, I probably
They
actually
normally
help
do.
more than
Yeah, they normally do.
Okay.
That's the most common thing you'll hear from patients that have seen other people. Oh yeah, you put me on this electrical thing that shocked my muscles and
Or vibrating.
put a hot
chair,
pack on me, yeah.
roller table.
Yeah, roller table's a common one as well.
So at that point, would you move on to the ortho neuro tests? Explain
Well,
that.
I would just end your history by saying, is there any other history that you have had recently or have had in the past that we haven't discussed at this point in time before I move forward with my examination?
Is there anything in your health history that is recent or long-term that's happened to you that we haven't talked about yet that you'd like to tell me about?
Not that I can think of.
Okay.
Did a good job going with that.
Okay. So what we're gonna do next, I'm gonna do a few orthopedic and neurological exams. We're gonna be checking for your reflexes and just ruling out any other issues that might pop up, and then we'll go from there.
All right,
Okay.
sounds good.
So we're gonna start out by popping the table up.
On purpose, huh?
There. Okay. I'm gonna start out by compressing your head here, Tristan. Does that give you any pain?
Yeah.
Compression down through the
I
spine
can feel
here?
a little bit down in the low back.
In the low back?
Yeah.
Okay. On the center, right, left?
Center and a little bit to the right.
On the right side. Okay. Now if we turn you this way and extend you over here, push down on you. Any pain doing that there?
Maybe like a 0.1 there.
Okay. And then how about over on this side here?
Nah, nothing on that
Nothing
side.
on that side. Okay. And then check the deltoid next. Go ahead and raise your arm up here. Resist my pressure here. Push up against me. Good. And then let's check this side here. Resist that pressure. Good.
I'd also just have them do that lateral flexion to see if they have any
Just side to
tightness
side
or.
like this.
Yes.
Okay. Any pain or discomfort
A little bit of stiffness.
going to that right side?
Yeah.
How about going to the left?
Not too bad actually.
Not too bad.
A little bit more on the left side.
Okay. I think I got them all right.
Yeah, that was good.
Okay.
Distraction.
Oh yeah, that's a biggie, by the way. Yeah, that's a
Okay.
good catch.
This is the one that's gonna tell you
If they're amenable to doing
I'm
this.
gonna lift up on your head here. You tell me, does this make your problems worse or better?
Feel better.
Feels pretty good?
Good.
Okay.
I always say at that point, you're gonna love me then,
There you go. Alright, check some reflexes here.
because that's probably why they're in to see you in the first place, is to get that ring there.
So you let that on right there.
That's why you came in, isn't it, Tristan?
Mm-hmm.
I mean, that's most people.
This way. Still learning how to cradle the arm here a little bit. This.
I don't know why the way we do the reflexes in here isn't more.
Adopted.
I remember thinking, I don't know.
Sorry. No, you're good. I was trying to stimulate there.
Yeah, I mean, I don't even move my feet at all. I don't have to change positions at all.
Now, Tristan, I'm gonna have you lay face down on this table. We're gonna check.
I check posture first.
Oh, posture, that's right. Let's have you stand right here in front of the
And
mirror for
with
me.
the history of shooting pain and stuff, you can't do like straight leg raiser or
Yeah.
vectorules.
Yeah, if the history dictates and you want to rule those things out, you do straight leg raise and
Okay.
Kemps and
So you can add and make it more specific depending on the cases and stuff that are in the room too.
Gotcha. So Tristan, I'm gonna have you,
I'd be like this. This is how I walked in.
I'm gonna have you close your eyes and bring your chin down to the ground and look up at the sky.
Cool.
Feel it pulling there. And then look straight ahead.
Yeah, that's not fun.
And go ahead and open up your eyes for me. So what you can see here is you've got a shift going on this way over to the left here, okay? Everything else on top is going to the right. Not too much anterior head carriage, just a little bit. Forward head posture, that's pretty good. Been watching your posture lately. And a little bit of rotation in your pelvis, okay? So that's what we're gonna be checking for.
so you want to point those things out to the patient while they're looking in the mirror. Do you see that? I always say, do you see that? Tell your left hip's closer to your arm than your right hip is.
Sure. Notice how the spacing here on this side is a little bit more narrow than
That's
on
just
this side
space and
here.
education for the future. They can just look at themselves in the mirror and know when they need a tune-up.
Yeah, sure. And so this is what we're gonna be basing some of our findings off after we adjust you to see how much that's improved. And that's also a good indicator for when you need to be adjusted.
Yeah,
If you've
good.
got those postural distortions going on.
Yep.
Let's have you go face down on this table right here.
So you want to be educating them every single visit with everything. That's good.
Alright, so checking here, Tristan. Legs are fairly even when we come to this position, maybe slightly short on the right side. I'm gonna bring you up in this position here. Does that low back tighten up at all going there?
Yeah.
Okay. It goes from slightly short to shorter on that right side. Now what I'll have you do is I'm gonna have you lock this leg up for me and raise it to the sky size again. And back down to the ground. And then let's do this side here. Any pain or discomfort doing that test there?
Just on the wall. They both hurt the low back, bringing them up, but on the right side.
Right side most. Okay, gotcha. So we've got a positive, is it knotless, is that what it is?
Knockless is where they have pain in the low back when you bring their legs up.
Positive knotless on that right side, and then we had the sacral deviation test also on that right side too.
Right. And a positive Deerfield on the right too, I believe.
On that right side, okay. And then that's when you would go through and just check the rest of their spine.
Yeah, I palpate all of it. And just tell them where you're finding things, because that's impressive to the patient.
Sure.
That you know where they are instead of having to ask them.
Does that get tender through there, Tristan?
Yeah.
Okay, goes pretty tight through there, and then we get up to your mid back through here, we've got a couple of things going on right through there. That upper back. Okay, a little bit there. We've got a couple more up through your cervical spine there. So what we found here, Tristan, is that we've got multiple subluxations happening that's causing some of your postural distortions going on. Through your sacrum, your pelvis, your mid back, and your cervical spine here. And so, what would you say after that?
Let's say, in light of having these conditions, I am able to adjust you today if you would like for me to move forward with that.
Okay. And
That's an oral consent.
Sure. After going through your health history and your exam, we are clear to move forward to adjust you and help with these problems if we have your consent to do that, if you're ready to go.
Let's do it.
Okay.
Good. So when you get oral consent and written consent, what are you doing for your malpractice coverage?
CYA.
Yes, right.
Alright. So you're gonna feel that table pop up there?
You wanna drop that?
Drop this piece down here.
acute patients, you'll always do what you did there, is help lower it down.
Yeah, so it
You
doesn't
don't
just
want,
flop
yeah, you
down.
don't want it to just flop.
Alright, so we're gonna start up by adjusting the right sacrum here. Right pelvis. Center sacrum. Left sacrum. Right sacrum. Not until 5 here.
Nice.
Big breath in and let it out. One more of those.
Alright.
Big breath in here.
That looked good on bringing this attention. Did it feel like he did it to
Yep,
you?
and on the very first lumbar, he started and got to the L4 spinous, and felt that he was going higher,
Yeah.
and went back down
Oh,
to
good,
L5, and
good.
went back up.
Specificity matters when you're line drive.
Yep. I was
Context.
gonna comment on that, but you were doing a good job actually going through and being efficient about it too, so I don't wanna stop you.
Right? Throw out the group.
Yeah, I wanna throw off your flow.
Big breath in right here. Let it all out. Let's have you drop those hands in right there and let it all the way out. Alright, there it was. Okay, now we're gonna be working on your cervical spine here, okay? You're gonna feel the table pop up just like before, but up by your neck. Middle of the neck right here, C3, C4. Scoop it there. A little bit lower on this one. C2 right here.
Perfect.
Now let's have you lay on your back for me. So this next one here, we're gonna be contacting your face, right here on the zygomatic arches. We're gonna be bringing your head up and over your body again, okay? Which is all about retraining your body. You just wanna be in a proper position. Just have you bring the arms out like a T shape. Let's scoot down just a little bit for me.
You notice what you did today that made a difference on those rib adjustments? You got your episternal notch
Yeah.
over it.
I always struggle with that left.
Because when you're just trying to pull it, yeah, when you're over it like that, though, it's easier.
Makes a big difference.
Yeah.
All right, Tristan. So this one I'm gonna be pulling on your leg here. Should feel go all the way from your knee up to your low back. Okay. Let's do this side here. Nice one. So just turn it over there. Okay. Now let's have you sit up and face that wall there for me. Be sure to turn this drop off so it's not popping up on us. Check your shoulders here. Turn your face to the right for me just a little bit. That's go back there. Okay.
You should feel radius move there too, even without that cavitation. Cause
Little bit, yeah.
all the move there well with the cavitation,
Uh-huh.
and before that radius even move to it, I'll a lot of times take that as an opportunity to explain to them, hey, that's a good example of an actual adjustment where we don't always get that associated pop and click. So if you go to other chiropractors who are twisting you on your side and still getting all these loud pops and snaps and stuff, it doesn't necessarily mean you're getting the
Yeah, that's
correct
good. The difference too
adjustment.
is I was always going the opposite way
Yeah.
to adjust it.
When patients too, because like I'll do some of these adjustments on people and know that we got good movement, they're like, what moved? I didn't get a pop or a click. So they think that,
Yeah.
some patients think that the pop and a click is the adjustment, when it's vice versa. It's that motion that we're establishing in that joint capsule to stimulate the mechanoreceptors.
Well, even these doctors watching our videos say, "Oh, he's just going for the crack," you know, like that guy did in that white chiropractor, just like the.
Yeah. Alrighty, now we'll move on to the ring dinger tape.
Well, I have to say, out of all the docs that we've trained, you picked up on all the lines of drive and contacts quicker than most.
Let's go here. I was gonna say, just give me a few reps. We'll figure it out.
I'm always curious too if that has anything to do with them being semi-fresh out of school, that only been like 2-3 years.
I think it has more.
They're also just a great doc.
I think it's more intelligent too.
Yeah.
I was gonna say, I tried really hard during chiropractic college to get it for me. I had a pretty solid GPA through the whole thing. There was a bunch of people that would try and go out and, you know.
Yeah, I do typical college stuff.
Yeah, pretty much. But at that point, I'd already had 3 kids. I'd been in the workforce
You're
for 5
ready
years and all that stuff.
If you're gonna do this the rest of your life, it's good to learn it.
Exactly,
I was
that's why.
ready to go.
Yeah.
And that's the way I trained my college education at Palmer. I wanted to know the material.
Yeah. And that's why I explain to people too all the time that I was really glad that I left and went to Iowa, because it got me away from a lot of my typical distractions
Yeah.
Yep.
home life.
The people you knew and all that stuff.
Yeah.
Feel like we go one more on that, or you good
No,
right there?
that's
Nice
good
and
right
snug?
there. Yes.
Okay.
Did you say you went to Life West, right?
Yep. Sure did.
Yeah, they got a good core program.
Did you do any seminars and stuff while you were there, or clubs or anything?
I honestly just tried
Everything.
everything I could. Yeah.
Nice.
So I was in Gonstead Club a little while.
Yeah.
I did some upper cervical stuff for a little while just to test the waters, everything, see what I like the best.
I did the same thing just because I wanted to try it all and be able to express that to my patients.
All right, deep breath in. Let it all.
Nice. You're getting even more fluid with it too.
Oh yeah.
Don't worry,
Well, that's the one part of the test I'll fail right there. Just get these stinking pins out.
Don't worry, your patients won't let you fill it.
Yeah.
I'm sitting there trying to adjust their cervicals and they can't breathe. Just a little bit there.
Nice.
Perfect.
I'm not afraid to get in there and adjust too, which is nice. Some people are hesitant.
You can still lay a little bit more of your weight back into it though, Jared.
I would say the one thing really that I would comment on, not that there's really just the fluidity of it. It's just leaning back and in one fluid motion, as opposed
You
to
get-
like
you get
paying
more of
attention
a-
and thinking about it for that split second. But again, you're still
You're
very
still,
fresh on mind
it's
things.
better than most, that's for
Yeah,
sure.
Absolutely.
But I'm just telling you, you can put your weight back into it a little bit more and get a better, deeper adjustment.
And as you do it rep after rep after rep, that's
Yeah,
where
you'll
your
get used to
neuroplasticity
it,
is
and
gonna
I mean,
get that fluidity
you'll
into it.
develop that too. That's the little neuroplastic things that go on in our brain.
Check the posture here. And bring your chin down for me. Look up to the sky. And look straight ahead there.
And I always comment on range of motion
Yep.
whenever there's, oh, you see the difference in your range of motion
See the
already?
difference there when you tilt your head back. There wasn't as much of that low back pain.
Yeah, and a lot of times too, so like even when I'm bent forward, I was like grabbing my low back and I was telling you like, hey, I felt a little bit even just going forward there. And a lot of times, not every time, but a lot of times when patients do the post-adjustment flexion extension, they don't have a lot of
Right.
that same tension or
Right.
sensation when they go through it. And so kind of note or ask, do you feel any of that same sensation?
And I always
you
say,
felt
did
before
that
the
feel
adjustment?"
smoother than it was
Yeah,
a few
and then
minutes
A lot of
ago?
times they're like, oh my gosh, no, it hasn't felt this smooth in a long time.
Yeah,
So.
Well,
Yeah.
then also noting that the space in between is a lot better there. Head's much more over the shoulders. Okay.
yeah.
So let's go ahead and have you tuck your chin down. And bounce your muscles, signals here. Help relax those paraspinal muscles a little bit more.
There you go. So this is the one thing you gotta make sure and bring those muscles to tension.
Okay, go ahead. Show you your homework here. You're gonna bring your shoulders up for me. Just kind of shrug them up, bring them back. And then you're gonna retract your head back and look up to the sky. Yep, just like that. Hold that there for a second. Now when you do your homework at home, you're not gonna do holds like this. You're just gonna do quick reps, 15 times, 3 times a day.
I can do that.
Okay. Now go ahead and tuck your chin down one more time and look up. Feel smoother there?
Yes, sir.
Okay. All
I'm
right.
taller.
Okay, what's the final thing you want to do with the patient before they leave?
Have them sign their
Well, you gotta get
those
their
numbers.
post-adjustment numbers.
Okay.
How would you rate your low back pain now compared to
Now
When you
just
came
rate
in.
that low back pain now compared to when you came in.
Maybe a 0.5 for some soreness.
How about your thoracic spine discomfort you were having?
Nothing.
And how about that neck cramp on your left side?
Feel good.
And no headaches, nothing like that. Right knee, how's that feeling right now?
Feels good.
Okay. And I'll have your signature or sign your name.
Always have them give the numbers, because if you write a number in there and you didn't ask them that,
Okay.
just have them give you the number. How would you rate your right knee pain right now?
Okay.
Nothing, 0.
0.
Yeah, just, is that 0? Yeah.
Okay. And let's plan to see, I don't know, what would you say in that situation?
I'd say we want to do at least one follow-up just to make sure you're stable.
Okay.
And, you know, we can do that either this week or the next week, whichever you prefer. But the sooner you get them together, the better.
Okay. Well, let's plan to follow up with you either this week or next week, just to make sure you're stable. Any sore spots that you have, because you will be pretty sore, okay? What you want to feel is sore and better. Just some crushed ice on the end of the sore areas, especially that low back. Okay.
For how long?
For about 20 minutes at a time.
And how often can I do that?
And you can do that as long as you take it off for about 10 minutes. You can just
No, every hour.
every hour.
20 minutes on, hour off. 20 minutes on, hour off.
Okay, gotcha. Okay, cool.
And then what else are you going to tell them? There's their homework right after they leave.
Oh, you're gonna go outside. You're gonna take a nice brisk walk, walking as fast as you can, about 10 minutes around the building.
Not carrying anything.
Not carrying anything, so you're not having extra weight on one side, no backpack, no wallet, nothing like that. Gotcha.
You know, and I just tell them at this point, you know, we can retrain your brain how to hold you in this new position quicker when you do that. It's called neuroplasticity. Keep putting in their heads that everything that you're doing is to affect their brain physiology. Because that's a whole lot more deep than just popping their necks and their back.
Right. Makes it a little more meaningful.
And they appreciate that.
Yeah.
Okay.
You want to make sure he signs that too.
Yep, he's signed
Initially,
off.
okay. Good. That was a good visit.
Yeah, that's great.
I think you did a great job on that.